Hello, and welcome. Hi, Dolores. Hi, Kay. Hi, Dolores on YouTube. Hi, Amber. Nice to see you again tonight. I'm glad you were here last night also. Please share, everyone. Okay, so tonight I would like to begin by sharing part of a thread. Of course, so far I've been sharing a branch of a thread in which whole Washington supporters were exchanging opinions with some MMT proponents who were critical of the whole Washington effort, simply on grounds that a state-based program, in Washington, was very sovereign and would therefore have a greater risk of running out of money. And so that was then a consideration that we saw there. Okay, let's see if I can find. Here I am. Okay, you should now be seeing a Twitter thread. And I think I'm going to give you a better look at that by giving it the full view. And you'll see my face again a bit later. But here we are in one branch of that particular thread where some MMTers were exchanging opinions. Now this branch came off of a bit of a hostile exchange between Jules and Laura, the leader of the Red Berets in Washington. And so Jules said, truthfully, IDGAF if you block me. What the hell difference would it make in my life? The less annoyance on Twitter. There you go. I've given you the ultimate excuse. # over it. And Laura replied, indeed, just like what you're doing here on Twitter has not made material change. Actually, it has. It's had a negative impact. We're outbuilding community, bringing new people into the Medicare for All communication loop. People who are no doubt not in Bernie's database. Kevin St. Fort said, I feel the arguments made here about whole Washington and state Medicare for All, hurting Medicare for All, remind me of the fear people stated regarding force the vote and putting Medicare for All to a floor vote. I think that fear is overblown and debilitating. We should not fear using all tools to get Medicare for All on a federal level. An incremental change for the privileged few said, it's not the same. They're literally not the same thing. One is state-funded, which requires taxes. The other is a national program that does not require tax revenue. Please at least acknowledge this as it is pure truth. Well, I don't have any trouble, in acknowledging that. You stated it very carefully. A national Medicare for All program is one that does not require tax revenue, though undoubtedly there would be tax offsets to such a program because of the nature of politicians and the fables they adhere to and the difficulty of educating people on the MMT point of view. So those things have to be stated, but it's easy to acknowledge what you just said. The issue is, how much of a difference does that make in the concrete case of the state of Washington itself? And Georgia Davenport replies and says the hashtag MFA sponsors both say it will be funded by taxes. We modeled the whole Washington Health Trust after the funding mechanisms that Bernie said he recommended for the national bill. He and Pramila have never mentioned MMT. And that is true also. That is true. The MMT commenters here who are opposed to the whole Washington effort ought to acknowledge that. And Nathan Becker, net backer, says, it is disappointing that Bernie wouldn't bring up why the plan in Vermont failed. Quote, when the governor admitted what critics had said all along, he couldn't pay for it, unquote. No state can tax itself to prosperity or grow without any growth in the money. Dollars have to come from the federal government. And this is what Peter Shumlin decided upon in Vermont when he created a block to Medicare for all. He was there to evaluate it. He decided that the tax money was not there. And there are some graphics from the Politico article by Sarah Wheaton. I'm not going to go into that. I don't think it's really relevant because Vermont is a small state with a small pool of people who would be covered by Medicare for all. And there is an issue, of evaluation, whether Medicare for all could be viable in Vermont. I personally think it could be, but this is not the place to make a detailed case for it in that state. It is really not relevant to Washington, which is a much larger state with nearly 8 million people in it. And Laura says, are we back here again? Georgia says, gosh, I feel like I'm experiencing Groundhog Day with these Twitter MMTers. Eric Hurd said MMTers are right about deficits and inflation, but all it takes to convince most people that MMT is bullshit is a 5-minute conversation with an average MMTer. I don't know if I agree with that, Eric. I hope it's not so. I don't think that I'm an average MMTer in any case. I've written 7 ebooks, which applies MMT to various things. You can find them on Kindle. I don't think the average MMTer has done that. And Laura says, I got myself out for an hour or so despite the heat of the day not being ideal. She said that yesterday. And she said, maybe I'll take some MMT knowledge and philosophy out with me as I interact over the coming 6 months. I have the book now. This is Stephanie's book. But after all the times that GEO Davenport repeated herself, and I emphasize that our reps are deeply invested in protecting the profit motive. Laura then replied to herself, it's a bit disingenuous to say there weren't a group of individuals hell-bent on wasting our time rather than just saying, we hear you, good luck with your efforts. I never even got one answer for the question I asked several different people. And she continues, I asked repeatedly of quite a few different individuals with concerns about whole Washington, quote, what is your strategy and timeline for achieving national improved Medicare for all, and what organizing actions are you planning that we can help to amplify and support you with, unquote. That is a very relevant question. She said there was no answer, but probably those individuals that had concerns were not in a position to answer the question. The person who is really should be in a position to answer that question is Pramila Jayapal, the former Washington rep herself, and the coordinator of the national strategy at this point in time. Point in time is obviously redundant. I should have just said at this point. But the key thing is that she's the one coordinating strategy. She's obviously co-opted the squad to her strategy. She is now the sole head of the Congressional Progressive Caucus, as well. And I'm very sure that she's calling the national signals for her group in Congress and for hundreds of groups that support them. So we really need to ask her the question is, what is your strategy and timeline for achieving national improved Medicare for all, and what organizing actions are you planning that we can help amplify and support with? This is a good question for Jayapal. If they sincerely believe that Medicare for all can't work at the state level, then it makes sense for them to argue against such efforts. But they should at the very least engage in discussions over why they think it can't work and answer your question about national strategy. And Jim Nicola says that Medicare for all by definition is national. If every state can't do it, it's Medicare for some. The majority of states do not have a sufficient tax base. Relatively few do. Even states with the biggest economies struggle with budgets. There is no budget constraint at the national level. That is mostly true. I don't know if relatively few do. I suspect, judging from the size, of European populations that have something similar to Medicare for all, or universal health care, in any case, most probably Washington and Oregon and California do have populations that are large, sufficiently large. Also, Michigan has a population that is large enough, and Minnesota has a population that is large enough by those standards. Illinois has a population large enough. Wisconsin has a population that is certainly large enough. I think the states with a population that are large enough probably have the heavy majority of the population of the United States covered by Medicare for all at the state-based level if they were all to enact that. Yes, it's true there's no budget constraint at the national level. It's also true that it's Medicare for some, unless, of course, the momentum of more and more states getting into Medicare for all then creates the kind of push that would be needed for the national government to financially support any state that wanted to implement a national Medicare for all program, basically going through a process similar to the Canadian process, granting that the situation here in the United States is much more complicated than it was in Canada during the 1960s. Andre Stackhouse says, this is a bit like me saying that it's not Medicare for all, that covers everyone in the world. Whole Washington covers every resident of Washington because we are the ones who would be voting for it. Jim Nicholas says, no, Medicare for all means covering everyone within our domain. The entire world is not our domain like some think it is. That said, I'm going to back off and give the willing a chance to read the book and think on it. Thanks for your engagement. Yes, everybody should read Stephanie's book. Andre Stackhouse, who is a Medicare for All supporter and an MMT supporter, says, quote, our quote-unquote domain comes down to which set of imaginary lines you think are important. The Washington state government should be expected to cover the health needs for its residents, quote, Washington's domain, if you will. The federal government should be expected to cover all U.S. residents. And Nathan Becker then chimed in with a reply, quote, domain comes down to which set of imaginary lines, not really imaginary lines. There is 3 separate issues regarding domains to consider: the financial ability to pay, the legal authority to pay, and productive capacity to provide the required services within that particular domain. I think on all those grounds, the Washington probably does qualify. Andre Stackhouse says that was not my point. He claimed statewide Medicare for all can't be Medicare for all because it doesn't cover everyone in the U.S. I said that was like saying national Medicare for all isn't Medicare for all because it doesn't cover everyone in the world. I think it is like saying that. I agree with Andre about that. Andre says their response was that the Medicare for all doesn't have to cover everyone in the world because it's not in the our domain. I think that answer doesn't really explain why Washington has to cover everyone in the U.S. for it to be Medicare for all, but the U.S. doesn't have to cover everyone in the world for it to be Medicare for all. But Nathan Becker says, I get your point, but I think you both are playing semantics. Medicare, quote unquote, as a term has a specific context that's widely accepted. It is a U.S. federal government program. So one could argue that for state-level programs, it should be called Medicaid for all, because Medicaid is state-level. I'm not sure I get that particular argument, Nathan. Maybe you'll make it clearer in the following tweets. But if we were arguing about health care for all, then obviously the domain expands beyond U.S. boundaries. I agree that a state-level program shouldn't need to cover the whole nation, but then a national-level program doesn't need to cover the whole world either. That's where I was defining the boundaries of domains that are legal in nature and defined by the sovereignty. I really hope some of us can get on a Zoom call sometime to talk about this. Again, my goal here is not to disrupt any of your efforts, but to provide more background information to make our case stronger toward success. We can't afford to fail in our efforts to make progress. Okay, I agree we can't afford to fail in states that clearly have the capability for Medicare for all if we compare them to nations in Europe that are non-monetary sovereign countries. But when we get to states like Wyoming and Vermont and some of the other states with rather small populations, it might be the case that both the financial power of the states and the size of the risk pool are not favorable to the success of Medicare for all in those particular states. This, however, does not apply to Washington, to Oregon, to California, and all the various states, I've mentioned. Here's an acknowledgement, of my live feed by Laura, and Ramona Masacci then responds, and she says, we should work on getting a bill written and passed in Congress, a revenue-sharing bill in the form of block grants to states with no conditions. Thank you, Joe Firestone, PhD, and that Sunback fan for both coming up with this solution. And thank you, Ramona, for acknowledging that. and for your proposal. And I replied to that, and I said, not sure it should be unconditional, because if you give the money for states that would be necessary to support a Medicare for All program in the form of block grants and has no conditions on it, then many of the red states would just use the money for something else, like deeper tax cuts for the rich or something like that. So I said, no, not sure it should be unconditional, perhaps a block grant of, say, $10,000 per person granted to each state to be used to strengthen the Affordable Care Act, because, of course, Joe Biden says he wants to strengthen the Affordable Care Act by giving the states the means for state-based improvements to Affordable Care Act, to the Affordable Care Act. That would give Washington $78 billion per year for that hashtag MFA program. Bet that it cover it. I'd like some comments on that from people from whole Washington who may be watching at this point. Would a $78 billion block grant for a Medicare for All program in the state of Washington actually cover Medicare for All there? I think that would, because when I project that out for the whole United States and all the territories and everything else, assuming the 330 million population in the United States, but that amounts to roughly $3.3 trillion as a budget for Medicare for All. We're currently spending, I believe, close to $3.9 trillion, tending towards $4 trillion right now. I figure Medicare for All should be able to save $700 billion in the first year. So I think that $78 billion per year for whole Washington, given its population of 7.8 billion people right now, it seems to me there's a pretty good chance that would cover the whole thing without the state having to come up with a dollar itself. So I'm making that kind of block grant proposal. I'm saying that if that were passed and each state could ask for such a grant, then each state would get enough money to improve the Affordable Care Act, and that many states would choose to do state-based improvements on the Affordable Care Act that would be Medicare for All programs for their state. I know all the states I previously named would probably be tickled pink to actually do that. And as an MMTer, I know that the federal government can certainly afford to do that. Now, I didn't want to raise the issue of how you're going to pay for it here because, as I explained in my last live stream, things are always paid for in the same way. The Treasury sends money to the recipients of various programs to pay for those things. So that's the way everything is paid for in the federal government. If the further question is asked, well, where does Treasury get this money from? Where does it get the reserves from? The answer is it gets the reserves from the Federal Reserve Bank, which creates them anew anytime it adds reserves to the Treasury spending account. Look, Ma, no tax revenue involved. If we push it further, of course, there would often be tax revenue involved and bond revenue involved as well. But in the direct line of how you're going to pay for it, it's always the same. It's always Congress is going to appropriate the funds. The Treasury is going to spend what Congress appropriates. When the Treasury runs low on money in the Treasury spending account, there are various things that trigger Federal Reserve actions. And the Federal Reserve actions then result in the Federal Reserve actually filling up the Treasury spending account. Well, you might ask, what are the mechanisms that would be used by Treasury in this instance? And there, I would reply, from my own personal point of view, I would have two mechanisms in mind. I won't go into one of them because Congress is not going to pass that at this particular stage. The other mechanism is the issuance of platinum coins by the Treasury Department to pay for it. And I would suggest that based on Joe Biden's authority, he could order the Secretary of the Treasury to order the Director of the Mint to mint a $3.3 trillion 1-ounce platinum coin each year to cover the revenue sharing for the Medicare for All program. Okay, I've written a book on how that could be done. It's called Fixing the Debt Without Breaking America. And you'll find it, okay, on Amazon. It's been out since 2013. It was revised in 2014. It's there for you to see. It's pretty cheap. It's $9.99. If you have the unlimited access to Amazon Books, I forget what that particular program is called, then you can download the book for nothing. It's easy to get, okay? So that's the way I would handle the how you're going to pay for it thing if anybody asks that. Anyway, I wanted you to see this particular thread because it has a proposal that I would put forward to get the states supported in state-based programs, okay, of Medicare for All. Okay, so now I'm going to leave this and go on to the articles I wanted to cover here tonight. The first one is, oh, there's Bonnie walking. You can see her walking because my background is not working tonight. I don't know when I next will get it working, but I get it working again someday when I have a chance to bother with these minor technical problems. Anyway, an article appeared in Common Dreams. Okay, it is by Anna Melanow and Kay Tillow. It was done on Saturday, May 29th, and the headline for it is Medicare for None, a response to the state-based the Universal Health Care Act of 2021. Now, this is a response to Ro Khanna's bill, which is getting reintroduced into Congress. The COVID-19 pandemic has laid bare the inequities, inefficiencies, and ineffectiveness of our healthcare system. If there was ever a time for healthcare reform, this is it. But some healthcare activists and their progressive allies, suffering from the frustration and disillusion brought on by the refusal of Joe Biden and Congress to consider structural reform, have accepted this defeat and turned to state-based reform, jeopardizing Medicare across the country. The people, of course, we've been talking to in whole Washington have not accepted this defeat. They have been active both at the state level and at the national level all through this particular period, and I don't know a single one of them. I haven't seen a single one of them say on Twitter that they've abandoned the fight for structural reform and for national Medicare for all and turned to state-based reform alone. Rather, they just don't want to put all their eggs in one basket, which is a perfectly sensible notion when you've got lives on the line in Washington. And just why they're concerned to have a backup in Washington jeopardizes Medicare across the country, I do not see. Healthcare is a national responsibility. I couldn't agree more with that. It's a national responsibility. That doesn't mean that people in Washington don't have responsibilities to their own state. To palm it off to states is a step backwards. The dream of Newt Gingrich and Ronald Reagan to shrink the federal government. Well, again, whole Washington is not palming it off to states. It's viewing its own state as a backup for the people of that state because they need Medicare for all now. Based on the historical precedents by the Affordable Care Act, the story of Medicaid expansion serves as a cautionary tale to those who'd like to leave healthcare to the states. Yes, it does serve as a cautionary tale, but again, nobody in the whole Washington movement that I know of has said that they want to leave healthcare to the states. That is not what this is about. On June 28th, in other words, a straw man has been created that, at least in Washington, doesn't exist in this particular article. On June 28, 2012, the Supreme Court issued a ruling on the constitutionality of the Affordable Care Act, Congress's attempt to provide near universal health care coverage by mandating individuals and employers to purchase health insurance, expanding Medicaid by lowering eligibility criteria, and widening health insurance protections. The court upheld the constitutionality of the individual mandate, but they gave states the option not to expand Medicaid, calling expansion unconstitutionally coercive. Okay, with this ruling, the Supreme Court opened the door to the balkanization of the ACA. Those that expanded Medicaid, those that considered it, and those that would oppose it permanently. It gave the southern states a political out and allowed the further racialization of Medicaid. Okay, I think that that's a true analysis. Okay, I don't think I ever thought that the ACA was any good. I thought it was very bad from an inequality standpoint because it opened the way to different standards in every single state of the union. Okay, I hated it for that reason, and most proponents of national Medicare for all hated it for that reason. Okay, of the original 26 states that brought this case before the Supreme Court, 12, mostly southern states with large populations of color, have not expanded Medicaid. 2 have passed, but not yet implemented expansion, and 3 only did so last year, a decade after the passage of the bill. These are the states that suffered the worst health outcomes when compared to expansion states. Non-expansion states have seen worse overall mortality rates, more hospital closures, and even higher school dropout rates. In 2018, states that did not expand Medicaid passed up $43 billion in federal funds, with the reintroduction of Congressman Ro Khanna's state-based Universal Health Care Act of 2021, we're about to see a similar balkanization of Medicare, the one national program that guarantees health care to everyone over the age of 65. The act, which would offer pass-through federal fund waivers, including Medicare, Medicaid, TRICARE, exchange, and federal employee health benefit dollars to states with a plan to provide comprehensive health benefits to 95% of its residents, defined as citizens or lawfully residing immigrants within 5 years, would end Medicare as we know it. Obtaining a waiver under this act does not set single payer as the model to achieve universal health care. In fact, states might choose to go the way of the ACA, a mishmash of employer and individual mandates, greater expansion of Medicaid, and more generous subsidies for the exchanges. The act would base benefits on the ACA, thus significant gaps such as no prescription drug coverage, limited reproductive rights, and no long-term care would persist. There is nothing in the act that precludes giving Medicare money to buy private insurance companies, strengthening profit-driven companies to pursue obscene profits and deny care elsewhere. The U.S. would become a nation of 50 different healthcare tiers at war with each other over federal dollars. States could band into a region to request a waiver application, pitting regions against one another. States unwilling to cover their residents could sit it out, much like the states sitting out Medicaid expansion, creating yet another form of racism and uneven health outcomes. If challenged in courts, this new expansion could be ruled, quote, coercive, unquote, again, giving some states a political out. But this time, seniors in non-universal states would see their Medicare dollars shunted over to states that provide their residents some form of health care. This is dismantling of the Medicare program. I do agree with this, actually. This is an argument, it seems to me, against the Ro Khanna's bill, which was first introduced in 2019, and it seems to be a critique, of that bill, which makes some sense to me. Anyway, proponents of a state-based universal healthcare approach believe states can be incubators for change, and then ultimately, once one state shows the way, all states will follow. I'm not sure proponents do believe this. I think this is to oversimplify what the proponents believe. I think that what they may believe is that if one state shows the way, some other states might follow. And once they follow, in other words, let's say Washington shows the way, and California and Oregon quickly follow once they see the results in Washington, that may cause other states on the East Coast to quickly follow. But I think what they're saying is that as more and more states happen to follow, then an emergent situation follows in which a tremendous amount of pressure will build on those states that are not following to go along. So I don't think they're saying once one state shows the way, all states will follow. I think they're saying something more complex than that, with due regard for the nation as a complex adaptive system, and realizing that if you have a bandwagon effect going across states, that bandwagon effect can get stronger and stronger. And I think this is a strong argument on the side of the state-based people. However, the next sentence, we have yet to see any evidence of this in the U.S. Well, what evidence could we see inside of the U.S.? Okay. In other words, we see that this was not the case with respect to Medicaid expansion. But again, Medicare for All and Medicaid are two different programs. The Medicaid program is severely limited. The pool of doctors and healthcare providers is severely limited. It has the stigma of poor people's healthcare that's attached to it on top of that, and it's always ill-funded. It's always ill-funded across the country. And that's not just because there are state-level programs involved. Okay, it's ill-funded because compared to Medicare for All, it's a crappy program. So why would we see any evidence of a bandwagon effect for all states to get on board, with Medicaid? But I do agree with the next half of the sentence. And to bet Medicare on this proposal seems unwise. Well, that's, I think, a really strong objection. The way I would meet actually that particular objection is to not throw the Medicare funds in. Leave the Medicare funds out. Leave the TRICARE funds out. Leave the VA funds out. Don't turn those over to the states. Keep those national. Or turn those over to the states on condition that the states will maintain the Medicare program as it exists in the national program. Such a condition could certainly be specified. The Supreme Court ruling set a precedent that states can use federal health care dollars as they see fit. Instead of seeing this as the problem, the sponsors of these bills see it as an opportunity to compromise, allow southern states to gut Medicare while allowing more progressive states to have universal health care. I don't know that the sponsors of this bill see it as an opportunity to compromise. I would like to see the evidence for that. I would like to see the links in this article for that's what the sponsors of this bill see it as. The main author of this bill is Ro Khanna. I doubt that Ro Khanna sees it that way. I think we should all question Ro Khanna, see if he sees it that way. I don't think that's correct. The U.S. doesn't need to dismantle Medicare. It needs to improve it and expand it to every person. Correct. Completely agree. The country must replace its broken, fragmented, profit-driven, and racist system with a universal, affordable, accountable, comprehensive, evidence-based, evidence-based, equitable, single-payer national Medicare for all. Not Medicare for none. I completely agree. Every resident of every state deserves this. This is something on which we can all agree. So, who are the authors? One, is Anna Melanow. She is currently practicing as a general pediatrician. She is past president of the Physicians for a National Health Program, an organization of 20,000 healthcare providers that support single-payer national health care. I think PNHP is one of the leading organizations that's been in support of Medicare for all for a very, very long time. I strongly endorse that organization, its body of knowledge, and the work, of its dedicated people, such as Dr. Melanow, over a long period of time. Whenever I want to understand something about Medicare for all that I do not understand, I go to pnhp.org to find out what the answer is to my question. It is the authoritative site on Medicare for All. Kate Tillow is the coordinator of the All Unions Committee for Single Payer Healthcare, which builds union support for H.R. 676. She lives in Louisville, Kentucky. Okay. H.R. 676, of course, is gone now, having been replaced by H.R. 1384 in the 2019-2020 period, and now by H.R. 1976. Those last two bills being written by Pramila Jayapal, partly in consultation with people from the PNHP. At first, there was no consultation with them, but then in 2019, before she finished her bill, she brought them in, and she's been in close coordination with PNHP and National Nurses Union and lots of other important groups ever since that particular time. So that's another set of objections. I've said where I agree with those objections and where I do not. I want to note this is not an objection to the whole Washington approach, to Medicare for All in itself. This is an objection to the state-based Universal Health Care Act, 2021, but there is no link in this article to the Act of 2021. I don't see a link. Do you? No, I don't see any link. I don't believe Ro Khanna has introduced it yet. I think he's about to introduce it, but I haven't seen a piece on it. And let's just see if I missed something in Common Dreams today. Maybe there's something. Nope, I don't see anything in here since last I looked about the introduction of Ro Khanna's bill. I guess a better way to look for it would be to Ro Khanna's site, but I'm pretty sure he has not introduced that bill as yet. He is on the point of introducing it. They may have seen, an advance copy. All we have, which we're going to look at in a few minutes, is the bill he introduced in 2019, which is not the same thing. That bill is subject to the criticisms that were leveled by the two authors, of the article that we just went through. Anyway, further development in Congress. This piece is from April 29th, 2020, but it has something to say which is relevant. Let me get rid of this ad, which is relevant here. And this is Neal wants to restore Nixon-era state and local aid program. House Ways and Means Chairman, by Richie Neal, says he would try to resurrect federal revenue sharing program popular in the 1970s and the 1980s. And there's a news conference there with Richard E. Neal and Speaker of the House Nancy Pelosi conducting a news conference to announce a new infrastructure investment framework on January 29th of 2020, when they were obviously thinking about possibly structuring that as a revenue sharing program. This article was written by David Lerman for Roll Call on April 29th, 2020. Roll Call's a pretty conservative type publication. House and Ways and Means Chairman, Richard E. Neal, otherwise known as Richie Neal, says he wants to go back to the future in the next round of coronavirus aid. Massachusetts Democrat told the nation's mayors Wednesday that he would try to resurrect a federal revenue sharing program for cities and states that was popular in the 1970s, and 1980s. The initiative would be part of a Democratic push to help states and local governments that are bleeding from lost revenue during the economic shutdown. We are going to insist on our side this package include direct assistance to all of you, Neal told the U.S. Conference of Mayors in a video teleconference that was streamed live on Facebook. I've even suggested you should know we contemplate returning to a grant initiative that fell by the wayside in the 1980s called revenue sharing to help you with getting through these challenging moments. While he offered no detail, he said a proposal could be unveiled in the next few days, certainly within the next week. Don't know if he went ahead with that. I don't believe he did. Program known as General Revenue Sharing, which offered largely unconditional grants to state and local governments, began under the Nixon administration in 1972 and was extended several times as its popularity grew. A Neal aide confirmed the congressman was considering trying to revive some form of that program, among other ways to help states and cities. By the time it expired in 1986, the program had transferred about $83 billion from the federal government to state and local governments, according to the CRS. That level of assistance would equate to about $313 billion over 15 years in 2008 dollars, the CRS calculated in the 2009 report. Of course, my proposal that I cited earlier would require a revenue sharing program that would spend at least $3.3 trillion per year to help the states to fund improvements to the ACA. So that's revenue sharing on steroids, you understand. Money was distributed by a formula that considered a locality's population, per capita income, taxing ability, and tax collection efforts. The program was designed to help ease state and local budget shortfalls while giving the local officials greater say in how federal money should be used, the CRS said. But revenue sharing was a success from the beginning, quote unquote. New York Times editorial said in October 1986, as the program ended amid mounting federal budget woes. Quote, big cities got a boost, and small-town America could first time count on direct aid from Washington. There was no strings on how the money could be used, and oversight requirements were simple. But the CRS cautioned the effectiveness of a resurrected program wouldn't be guaranteed. The agency studied the issue in 2009 as Congress considered its options for responding to the 2007-2009 Great Recession. By revenue sharing grants, it said, quote, may be subject to 2 time lags, thus increasing the potential for mistimed fiscal policy. It's not clear how long it would take Congress to agree on a distribution formula, which can raise a host of fairness questions. It can. I know that because I worked on distribution formulas, as I said last night, during the period from 1977 to 1981, which can raise the host of fairness questions. It was very technical work as well. Very much of it was based on statistical analysis and modeling, and it would be state-of-the-art stuff even today. Basing grants solely on need, for example, means that, quote, states may have been more fiscally responsible would receive less, possibly violating the fairness criterion, the CRS said. Well, we can modify the formula funding in various ways so it takes into account the fairness criterion. Neal said he was inclined to adopt guidelines used in the existing community development, the Block Grant program. That was a program, the CDBG, has been a program that HUD has used for many, many years, which provides grants for low-income housing and economic development projects. Right, it does do that. It's not clear how quickly grants could get the state and local governments to ease their budget shortfalls, the CRS said. Grants that take months to deliver may prove useless for the current fiscal year. But for example, I think this article may be a little bit dated because people learned how to streamline grants to recipients during the COVID period. At first, they were having a lot of trouble in getting the grant money spent. And they have been somewhat successful in learning how to streamline those things. Good legislation today could streamline getting the grants out much more quickly. That was the case, in the earlier years. Governors have been clamoring for federal relief of as much as $500 billion to make up for revenue losses. Cities and counties asked for about $250 billion, a request that was reiterated to Neal in the video conference on Wednesday. Well, I don't have to go through the rest of this, but you see the potential. You also see the problems. The point here is that Richie Neal would probably be in principle, he would be favorable to working with such a program, which he obviously has a fondness for. So maybe he could be worked on and worked with to get a compromise where, of course, he would be giving but many states the capability to retain something like the systems they have now, in approving the ACA. And of course, he would want to slow those down because he's bought by the healthcare industry. But he might entertain a compromise where state-based Medicare for all would be an option for states, and that the funding would be there when states passed such a program based on high revenue sharing. But I freely admit this would be something that would be problematic because Richie Neal is involved. And there's also the problem, could we put together such a CDBG-like program and pass it within the context of a reconciliation bill? This, of course, gets us very current into the reconciliation bills that are going forward now. That was not covered, of course, on April 29, 2020. We know a lot more about what is going on with reconciliation then, and it is not so easy, may not be so easy. But before we get to that, let us get to a further article. Well, not a further article, but let's get to take at least a brief look at Ro Khanna's 2019 bill. Okay, this is a bill for the 116th Congress, which was, of course, in 2019. And it was a bill to amend the Patient Protection and Affordable Care Act, what we know as the Affordable Care Act. The ACA was actually the PPACA, the PPACA, and to authorize the establishment of and provide support for state-based universal healthcare systems that provide health benefits to state residents and for other purposes. In the House of Representatives, to amend Title I of PPACA, he goes on, being enacted by the Senate and House of Representatives of the United States of America, and Congress assembled. Short title, this act may be cited as the State-Based Universal Health Care Act of 2019. This is not the 2021 Act. We don't know whether he's going to put forward the same thing. He may amend it, okay? The point is, what this act was about was clearing the way for states to put together programs that would give near universal coverage to states who wanted to implement a plan meeting the requirements for a waiver, okay, that would allow a state to get help from the federal government coming through the ACA Act. And supposedly the concept was that the tax revenues collected to support the ACA Act would be passed through to the states. But of course, not only the ACA Act was involved, but this covered health benefits that were going to be provided by many parts of the federal programs, specifically within the ACA itself. Sections 1301 through 1324 were relevant, Section 1402, Sections 33B and 4980H of the Internal Revenue Code of 1986 was relevant, Title 11 of the Social Security Act was relevant, Title 18 of the Social Security Act was relevant, Title 19 of the Social Security Act, which is has to do with Medicare, was relevant. Title 21 of the Social Security Act. Chapter 89 of Title 5 of the United States Code was relevant. Chapter 55 of Title 10, including coverage under the TRICARE program. Section 514 of the ERISA Act, okay, was involved. That was 1974. That was included in order to meet the kinds of objections that were levied by actually Margaret Flowers in the article I went through just yesterday. This all related to the pass-through of funding. The pass-through, okay, of funding. So I'm not going to go through this in a whole bunch of detail. That would take too long, and it's not entirely relevant with respect to what, okay, I'm going to say. But what I wanted to point out here was that, first of all, there was a regional waiver request and plan. Nothing in this section shall be construed to prevent two or more states in a region from submitting a single application under this section for a waiver that establishes a plan that is applicable to all the states included in such application. In the case of such an application and plan, the requirements of this section shall continue to be applicable with respect to each state included in such application. It specified the conditions that were necessary to apply for a granting of waivers so that funds that were basically earmarked for the ACA could be instead forwarded to the states. And the wording was, A, will provide in accordance with subparagraph B, health benefits coverage to applicable state residents that is at least as comprehensive as the health benefits coverage that such residents would have received under one or more of the specified health programs as defined in Section I-4 as applicable, for which such residents would have been eligible absent such a waiver. This language, it seems to me, does something at least to protect the people covered under Medicare. It seems to go some way towards requiring that the state-based benefits as a result of use of these funds would have to be at least as comprehensive with respect to Medicare by recipients as the federal funds were. Okay. But let's continue to go on here because I want to call your attention to a particular part of the Act. Okay, there would be a requirement, okay, to enact a law Okay, a law described in this paragraph is a state law, provides for state actions under a waiver under this section, including the implementation of the state plan under subsection A1B. Okay, a state may repeal a law described in subparagraph A and terminate the authority provided under the waiver with respect to the state. And what was the scope of the waiver? Under this section, the Secretary may not waive any federal law or requirement that is not listed in subsection A2. So there would be a panel that would be established under this bill, okay, a panel of basically technocrats to evaluate whether the state plan for comprehensive health care actually improved on the federal benefits. The intent here is to always get an improvement of the federal benefits, and presumably that would apply to Medicare for all too. So it seems to me the intent of the bill was certainly not to allow Medicare for none to be developed in the states. You have to create a particular a particular reading of Ro Khanna's bill to suggest that it would allow for Medicare for none, as suggested by the PNHP people. I don't think that their article actually demonstrated that with a close enough analysis of this particular bill. How waiver funds have been spent by the state. Okay, the number of residents of the state without health insurance, and a description of how the state plans to provide health insurance coverage in the subsequent 5 years to residents of the states without health insurance. How affordability in the state for health care has changed over the period. Whether the state, in other words, these are criteria for evaluation of states going through this program. Whether the state has achieved health coverage for at least 95% of the residents of the state. In my view, 95% is not even enough. Okay, so I don't think this bill is a rigorous enough bill. It has to be up there at 99% of people covered in the state, and it has to be shown that the 1% of people who opted it out purely on their own. Okay, in other words, that they turned down the offer, okay, of coverage. Okay. It has a provision for termination of the waiver if the state does not meet the criteria. Let me go a little further. There would be coordination of policies relating to the granting, implementation, and continuation of waivers through the secretaries, a number of secretaries of a number of agencies in the federal government would be coordinating to avoid duplication of effort by states or secretaries, okay, and director, and the panels would ensure clarity about waiver application status, okay, and approval. Let me get to the part I'm really looking for here before I end coverage of the Act. It specifies who would be the members of the panel. The panel shall consist of 11 members appointed by the Secretary of Health and Human Services. One shall be appointed on the recommendation of the Speaker of the House of Representatives. One shall be appointed on the recommendation of the Minority Leader. One shall be appointed on the recommendation of the Majority Leader of the Senate. One shall be appointed on the recommendation of the Minority Leader of the Senate. One shall be appointed on the recommendation of the Republican Governors Association. One shall be appointed on the recommendation of the Democratic Governor Association. One shall be a representative from the patient advocacy community. Two shall be representatives of a labor organization representing the healthcare professionals. who provide direct patient care, including at least one labor organizer that primarily represents registered nurses. One shall be a representative of primary care physicians. One shall be a representative of healthcare professionals practicing in rural or underserved areas. In general, each member of the panel should serve a 3-year term. A member shall serve after the expiration of the member's term. A vacancy in the commission. Members of the panel shall serve without pay. That was specified in there. They also wanted to put chairperson, secretary of HHS, or a designee of the secretary shall serve on the panel as chairperson. The vice chairperson shall be the administrator of FEMA, or a designee of the administrator. And there would be staff experts and consultants. Their pay would be fixed by Chapter 51 and Subchapter 3 of Chapter 53 of such title relating to classification and general schedule pay rates, and procure the services of experts and consultants in accordance with the provisions of Section 3109B of such title. So that's to provide for payment of the staff of the panels. The Federal Advisory Committee Act shall apply to the panel. This is, basically boilerplate. There's also some boilerplate about giving representation to representatives of the Indian community, and pointing out that a state may not require the enrollment of an individual who is an Indian in health insurance offered through a waiver under this section. So, by taking care to provide the consideration of for the Indian healthcare service and Indian healthcare providers, and the possibilities of contracting with them. And the contract addendum will be developed in consultation with tribes and in conference with urban Indian health programs operating in the service area of the state. And let's go through this a little faster. In this section, on definitions, this was the section I referred to before. Health benefits coverage. The term health benefits coverage means health insurance coverage, as such term is defined in Section 2791B of the Public Health Service Act 42 by USC 300 GG B. And 2, coverage under a group health plan, as such term is defined in Section 2791A of the Public Health Service Act. B includes any medical coverage or health benefits provided under one or more of the specified federal health program described in subparagraphs A through E of paragraph 4. And it goes on to define who residents are, who might be covered. The term specified health program, but that means the health programs whose benefits would be getting passed through to the states under this plan would include A, the Medicare program under Title 18 of the Social Security Act, the Medicaid program under Title 19 of the Social Security Act, the CHIP, Children's Health Insurance Program under Title 21 of the Social Security Act, the Federal Employees Health Benefits Plan under Chapter 89 of Title 5 of the United States Code, the medical coverage under Chapter 55 of the U.S. Code, including coverage under the TRICARE program, and exchange established under this subtitle, subsidiaries under Section 1402, tax credits under Sections 36B and 45R of the Internal Revenue Code of 1986. So that gives you the scope of the health benefits that would be passed through to the states. Now, the panels would actually determine, they would evaluate whether the states would be actually providing benefits that were equal or better than the benefits that were being received under the ACA or under the program benefits for the federal programs. So, this is all by way of saying I would like to see a legal analysis of this bill by the P&H people in order to document their argument that this is a bill that provides for Medicare for none. I saw their argument. I didn't think it was detailed enough to actually document that. Next, there was one more thing that I wanted to cover, and let me share that with you. I forgot to share Ro Khanna's bill with you. I'm sorry, but I don't know if you wanted to look at the verbiage of the bill through this little window here or not. But I think I covered it fairly well, okay, in any case. This is a piece from Salon. It is very recent. I am now sharing it. It's called Senate Parliamentarians' Surprise Decision Threatens to Derail Democrats' Infrastructure Plans. And this relates, of course, to reconciliation bills. This was written by Igor Durish on June 2nd at 6:21 Eastern Daylight Time. There is a picture of Chuck Schumer speaking to the press following a Democratic caucus meeting on May 25th, 2021. Schumer was urging his Republican Senate colleagues to support the January 6th commission legislation. Of course, they did not, but that is not extremely relevant to what we're talking about here. In any case, a new ruling by Senate parliamentarian Elizabeth McDonough threatens to upend Democrats' plans to pass President Biden's infrastructure proposals. So this relates to the possibility of passing a bill that would allow the revenue sharing help for whole Washington and other state movements, so that they would have more policy space, greater policy space to pass a Medicare for All bill. Anyway, McDonough quietly issued a new ruling on Friday stating that the Senate cannot use budget reconciliation, which allows the chamber to pass budgetary bills with a simple majority twice just to avoid a filibuster. Punchbowl News first reported. But the Senate also cannot revise a budget resolution without restarting the entire budget process anew, which would be immensely time-consuming and difficult. I don't know why it would be more time-consuming than it was in the first round. In other words, in the first round, they started to do this but late in January, right when they got control of the Senate, they started to do this. They had the budget resolution actually done very quickly, and they passed the whole reconciliation bill by March 15th. Seems to me that you could start from the beginning, and you could agree on a budget resolution, even if you had to start from the beginning. So the ruling could complicate Senate Majority Leader Chuck Schumer's efforts to avoid a Republican filibuster to advance the party's agenda, and likely means Democrats will get just one more shot at a filibuster-proof legislative package this year, in which case they might have to put the American Jobs Plan and the American Family Plan into a single reconciliation bill. Democrats used the budget reconciliation process to pass the $1.9 trillion corona relief bill in March, but efforts to include a federal minimum wage were rejected by McDonough, who ruled that doing so would violate the Senate's Byrd Rule, which prohibits extraneous items from being included in the legislation. In my other coverage of McDonald's, the earlier rulings by McDonough, I pointed out that the CBO had found that there would be a substantial budgetary impact of raising the federal minimum wage to $15 per hour. According to the Byrd Rule, things that have a substantial budgetary impact can be included in reconciliation bills. McDonough was not on firm ground by claiming that a federal minimum wage increase would violate the Byrd Rule, in my opinion. Furthermore, her rulings are advice. They are not determinative or binding on the Senate. Now, Joe Biden talked about her rulings as basically holy water, not to be trifled with. But maybe he feels differently now that they're just another stumbling block in terms of trying to pass his programs. And of course, there's always Joe Manchin reinforcing his silly ideas about the holiness of McDonough's pronouncements. But anyway, going further with this, Schumer's office claimed he had received a favorable ruling on a plan that would permit Democrats to use the process twice more this year, once for the next fiscal year budget in the fall, and once to amend the existing 2021 budget, while acknowledging that some parameters still need to be worked out. I don't see that this statement by McDonough necessarily contradicts what Schumer wants to do. You could use one bill to amend the existing 2021 budget. You could use a second reconciliation bill for the next fiscal year in the fall of 2021, because fiscal 2022 starts on October 1st of 2021. So far, this is consistent with it, but I don't agree with McDonald's ruling. I think it isn't clear from Section 304 of the 1974 Budget Act. It's not clear from that section that the revisions of earlier reconciliation bills would be limited to one bite of the apple. But even if one assumed that, there is enough time to get a reconciliation bill incorporating both the American Jobs Plan and the American Care Plan, it's called, I forget, the American Jobs Plan, the American Care Plan, something like that. But they could be incorporated into a single reconciliation bill. And by the way, one could also incorporate in that bill an item simply killing the debt limit law, repealing the debt limit law, entirely, to take care of the upcoming debt ceiling crisis that's coming our way on July 31st. By the way, that crisis could also be circumvented by minting platinum coins as well, so Treasury would not have to exceed, the debt limit. So this could all be done in a single bill this year, and that would leave the fiscal 2022 bill completely empty. Of course, then this bill could no longer be $1.9 trillion. It would have to incorporate the American Family Plan, I guess it's called. It would have to incorporate that too. If that bill were another $1.9 trillion, it would have to be a $3.8 trillion infrastructure bill. But so what? They could pass a $3.8 million infrastructure bill. There's no reason why they could not. Now would it contain the minimum wage? For my money, it could contain the minimum wage. And it also could contain the PRO Act, because both of those bills are going to have profound impacts on the budget. This is not something that can be determined by McDonough. She can give her opinions about it, her advice about it, but it's up to the Senate whether the Senate wants to take that advice. And it's up to the administration whether it wants to give credit to a parliamentary ruling by vetoing an infrastructure bill that passes the Senate and the House. If I were the president, I wouldn't want to do that based on an idea that what this hired person, the advisor, the parliamentarian of the Senate, has to say about whether what is being done is in line with the Byrd Rule or not. She doesn't have the function of legally deciding that. She's not a Supreme Court justice. She's only an employee of the Senate. Now, people, of course, have come out since this article and have been saying, fire her, fire her, fire her. I'm not going to say that. She's an advisor. She calls him as she sees it. It's the responsibility of the Senate to decide whether they want to take the advice or not. If things end up with a 50-50 Senate vote, then it's up to the vice president to decide whether she wants to take the advice of the parliamentarian or not. In that case, the vice president would be acting as the president of the Senate. Nobody is bound to take the parliamentarian's advice. That's not why the parliamentarian is there. The parliamentarian is a consultant. Anyone who's been a consultant, okay, or anyone who's employed a consultant knows the employer doesn't have to take the consultant's advice. That's the way it works in the real world. Anyway, Jake Sherman wrote a piece, Punchbowl News, saying McDonough cited a 1974 conference report saying that revisions to an existing budget resolution should be reserved for situations like, quote, sharp revisions in the revenue or spending estimates on major developments in the economy, unquote, according to roll call. She also cited the late Senator Ed Muskie, a former chair of the Senate Budget Committee, who said that revised budget should be the exception and not the rule, and should be reserved to meet changed conditions, not to take account of matters which might have been considered in connection with the budget resolution most recently adopted by the Congress. Well, Ed Muskie was the chair of the Budget Committee. Sure, he's a former chair of the Budget Committee, of the Senate. But his pronouncements on this score do not necessarily represent the collective intentions of the Senate of the United States. He is only one person, one senator. If McDonough cited him to support what she thought, that's fine. But he's no longer a member of the Senate of the United States in any case, and even if he was influential back in 1974, even then, his word alone could not be taken as the collective intention of the Senate in passing the Budget Act of 1974. She says the potential for abuse was clear in 1974 and is all the more obvious now, adding that overuse and over-reliance on a hyper-fast-track procedure in the ordinarily deliberative Senate will change the culture of the institution to the detriment of the committee and amendment processes and the rights of all senators. In the present context, that is BS. The reason why it's BS is because the Senate is no longer a deliberative body, and the Senate does not actually deliberate by using the filibuster. What happens with the filibuster is that a bill is introduced in the Senate, and rather than debating the bill on the floor of the Senate through a filibuster, what happens is a staff member sends in an email saying his senator is going to filibuster the bill, is filibustering the bill, intends to filibuster. And then it never gets to the floor, and there's no deliberation. There's no deliberation. There's no public debate about the bill. The Senate doesn't any longer do any deliberation. This is not about any deliberation in the Senate. I mean, McDonough is talking fiction in this respect. This is not overuse and over-reliance on a hyper-fast-track procedure. There has been one use of this hyper-fast-track procedure so far since Joe Biden has become the president of the United States. And that was to pass an emergency bill that was necessary for COVID relief. How is using this procedure one more time an over-reliance on a hyper-fast-track procedure? The culture of the institution has already been changed to the detriment of the committee and amendment processes and the rights of all senators. It's been changed by this hyper filibuster type of thing that allows senators to have staff members phone in an intention to filibuster and have that block bills in the Senate. The culture change has already taken place, Ms. McDonough. It's already taken place. And it is to the detriment of the committees and the amendment processes and the rights of all senators, because it sets up one senator as a total block on what can even be discussed, publicly discussed, in the Senate of the United States. So this decision by McDonough, Seth Hamlin, a former economic advisor in the Obama administration, said that McDonough was, quote, again, making up new rules out of whole cloth. To be clear, the parliamentarian is just making up random shit here, wrote Jordan Weissman, who covers economics for Slate. None of this is remotely stated in the law. Right. And Manu Raju noted the ruling still allows Democrats to use the budget reconciliation process for the next fiscal year, which begins October 1st, adding that the party was unlikely to use the process until the fall anyway. Well, what does that mean? It just means that Manu Raju had an opinion that, in his view, Joe Biden wasn't going to get Joe Manchin and Kyrsten Sinema to come along with another reconciliation bill in this fiscal year. But I beg to differ. If everybody builds up enough pressure on those people, because those bills are needed, then they could be passed in another reconciliation bill this year. The article says, but the ruling means that Democrats will not be able to pass Biden's $2.3 trillion American Jobs Plan and the $1.8 trillion American Families Plan, as well as other budgetary proposals in multiple reconciliation packages, as they had originally hoped. Well, as I said, that's debatable because the advice of the parliamentarian doesn't have to be taken. But even if her advice is taken, it's still debatable because someone could put down a legislative marker, a bill for $4.1 trillion that incorporated both the American Jobs Plan and the American Families Plan into a reconciliation bill that would be voted on by the end of July. And by the way, one that would also have the repeal of the debt ceiling in that bill, because you can include tax bills, spending bills, and bills concerning the debt limit, all in the same single reconciliation bill. They could still combine the proposals into a single budget bill, but any measures not included in the 2022 bill would have to wait until 2023 fiscal year begins in October 2022. That's really getting ahead of ourselves. We could combine the Biden proposals into a single multiple reconciliation bill this year, and those could be passed by July 31st. There is enough time. The first reconciliation bill was passed in virtually 45 days. This reconciliation bill could also be passed in 45 days if they get to it now and don't start going on vacation and don't start BSing. They could get it now. Anyway, all this is by way of saying we could have Biden's proposals inside a reconciliation bill. We could have revenue sharing inside a reconciliation bill too. We could have some federal support for whole Washington's proposals actually passed in this fiscal year. It is still possible. It is something we should pressure the federal government, to do. There should be another part of this reconciliation bill, which should be a federal revenue sharing bill to the tune of essentially block grants offered to each state, providing $10,000 per person for each state to submit state-level programs to afford to improve the Affordable Care Act with state-level programs that provide more comprehensive benefits, including Medicare for all. Including Medicare for all. Yes, it could be done. The bill for Medicare for all could be picked up for the states that wanted it, but by the federal government. And this would greatly facilitate the success of Medicare for all in those particular states, because the burden on the states, the burden on their businesses, the burden on their individuals would have been lifted by the federal government. And the parliamentarian is really in no position to derail this if Democrats in the House and Senate really want to pass it. It is on them. It is time they acted in the interests of the people, including the people of the state of Washington and other states that want to pass a Medicare for all bill now. So, that's what I have to say for tonight. I hope you liked this. It was a wide-ranging piece. It was designed to try to lay out what the possibilities are, what the obstacles are. We still have to receive Ro Khanna's new state-based bill in order to see whether that actually improves the situation for state-based efforts. We don't know whether it will. We have to wait and see. But I want to emphasize, whether or not we get a good bill from Ro Khanna, the Affordable Care Act, as it currently is laid out, does allow for states to go to the federal government under the Affordable Care Act and to request a waiver, a waiver of benefits that were legislated under the Affordable Care Act in return for the promise of a state to improve those benefits. That would deliver some funds, even without Ro Khanna's legislation. Under current law, some funds would still be deliverable to states that wanted to pass a Medicare for All bill and that could go through the waiver process. Go through the waiver process. So, it seems as though Ro Khanna's bill isn't even essential to get some help for states such as Washington, California, Oregon, New York, state of Minnesota, Pennsylvania, to get help if they want to legislate state-based versions, of Medicare for all. So, going all the way back now to the beginning of your comments. Steve Wolfrand says, I'm only getting comments since 9:15, and I know there was some more comments before 9:15 that I'm not seeing now. I just did a refresh on my comment stream, and I'm only seeing comments from 9:15. I know Sherry Weiss made a comment at 9:10 saying she was going to watch the rest of this later, but that she wanted to get a summary, I believe, from Amber. I think she said that, at 9:10. I know I've missed some of your comments. I don't think I can do anything about it. I just can't see them in this interface. Anyway, Steve Wolfbrand said at 9:15, you all know Medicare isn't free, right? They take that shit right out of your Social Security payment and then try to sell you supplement stuff. But not under Medicare for All, right? Under Medicare for All, no premiums, no copays, no deductibles, right? HR 1976, Steve Wolfbrand. We're not talking current Medicare, Steve Wolfbrand. We're talking Medicare for All. We're talking enhanced Medicare for All, HR 1976. Demand Better says MMT can facilitate wage-led growth and robust public services as long as the economic leakages, tax havens, excessive profits, imports, are small. I don't understand why MMT can facilitate this as long as the economic leakages like tax havens, excessive profits, imports are small. First of all, I'm not sure what excessive profits has to do with this. Tax havens, in relation to MMT, have nothing to do with it. At the level now where the tax havens seem to be at a level of $1 trillion per year, it still doesn't stop MMT-based policy from being effective in facilitating wage-led growth and robust public services. Also, imports don't have to be small. I mean, imports can be large as a percentage, of GDP. They can be 8%. They can be 10%. They could be even 12%. They're roughly 3% now, At their height, they were 6%. In all those scenarios, there's no problem with MMT compensating for those leakages to demand. And Belanadel says, further, I offered to call Laura last year. She said, thanks. Nothing nasty, but never followed up. I bought one of her beautiful red berets, handmade and lovely. She means well, and I wish her the best. And I think if she wants to work along with me, I'm going to work along with her. She seems fine to me, committed. Jeffrey Denton says, Pramila Jayapal won't even publicly acknowledge that whole Washington or the thousands of volunteers who have signed up with us even exist. I'm sure, because she's working at the federal level now. She doesn't want the slightest bit of possible distraction from her efforts at the national level. That's the way you would expect her to act. Don't worry about it. The more support you get for whole Washington at the state level, the more responsive Pramila Jayapal will be to you. Because you can affect state elections, which control her fate, and she knows that. So don't even worry about her public acknowledgement or lack of it right now. You can make her do it. When the time comes, make her do it. Demand better says, hello, Lana. Carmen Muniz says, streams keep stopping. Carmen, shift to YouTube. It's better. Lana says, hello, Demand. Not sure who you are. Steve Wolfbrand said, are you in Washington State? Dia Swift says, hi, nice to be here. Nice to see you, Dia. Lana says, I worked in California mid-1990s. Their funds ran out, and they were paying state workers and IOUs all over the local news. I hope it's not going to be an ongoing thing with state-based Medicare for all. Things have changed in California since the middle of the 1990s. They got rid of some of their notions as to how the legislature was going to work, in California. You no longer need 2/3 of the state Congress to pass new taxes, in California. I think it was 2/3 of the House was necessary, something like that. That was blocking increasing taxes, in order to pay for things. Anyway, she says, hope it's not going to be an ongoing thing with state-based Medicare for all. Doesn't have to be, because California is already spending a pile on health care at the state level. Given the savings to be expected for Medicare for all in California, it is quite likely that what California already spends would be enough to cover Medicare for all in California. Certainly, what California spends, plus the help it could get from the ACA, might well be enough to cover Medicare for all, in California. I'm not saying that for sure. I haven't really costed it out. But Gerald Friedman probably knows. I'll tell you one thing. If Washington can save $5 to $9 billion per year, with Medicare for all, how much do you think California, that is roughly 6 times, well, let's say Washington is at 8 million, right? Okay, so California is 5 times the size, of Washington. So it can probably save between $25 and $45 billion per year if it shifts over to Medicare for all. If they get some ACA help too, that goes a long way to solving it. Goes a long way to solving it. And if you raise taxes for the people there, and they save more themselves because they're in Medicare for all, they're going to love it. Amber says, see, that was a good way to give people space to learn. Lana says, Andre was gaslighting a bit there. Palana says, I totally agree with Andre on that. It's a U.S. versus state, not but the world. I don't think that's what Andre was saying. But anyway, but Dolores says, I'm fortunate to get my medication from the VA at no cost. I therefore do not have to pay the Social Security deductible. Kay says, dealing with Medicaid is an anxiety-producing exercise. Laugh out loud. Yes. Jeff says, I'm a whole Washington volunteer and I organize the events for the whole Washington Health Trust. We should work. I live in the 2nd Congressional District where Boeing was born. Jayapal supposedly represents the 7th Congressional District. I guess you're not satisfied with our representation of the 7th Congressional District, Jeff, right? Jeff says she could easily join us in Washington, could easily become the first state with universal health care. So I hope you understand why I have trust issues with her. Sure, I understand. Kay says she's still trying hard to push for it nationwide, and I think she should try hard. And by the way, whole Washington seems to think she should try hard also. The objective is not to weaken her effort. It's only to have a backup plan. Just working on 2 tracks to get what you need. Steve says, hey all, I'm up late. I've been watching on YouTube till now while chowing. Steve says, I'm tired of hearing how are you going to pay for it. Just fucking do it. We're dying out here. Look, someone's going to raise. How are you going to pay for it? So what you do is you tell them that you're always going to pay for it in the same way. If they then ask, where does the Federal Reserve money come from? You point out the Federal Reserve creates dollars out of thin air. Okay. If they say, well, what triggers the Federal Reserve to create the dollars out of thin air for the Treasury spending account? Then you explain, well, taxes can do that. Depositing the revenue from debt instruments can do that. But platinum coins can do that. Congress can order the Fed to do that through overt congressional financing. There are at least 4 ways to do that. But the key point is, there are more ways than just taxing people or selling debt instruments. Kay says, hi, Steve Gonzo. Glad to see you, buddy. Jeffrey Denton says, unemployment insurance is referred to as unemployment insurance. Social Security is referred to as Social Security to pay for it. But the medical insurance that hundreds of millions of Americans pay 2.9% of their paychecks into every Friday while people keep asking how you're going to pay for it is referred to as a tax. Yes, it's a language. It's often language. Steve says, video bomb Bonnie. And Steve Wolfbrand says, Epstein didn't kill himself. I don't even think he's dead. And Michelle, well, that's another story. We now know Steve Wolfbrand is definitely back. Jeffrey Denton says, exactly, Wolfie. And Steve says, good man, Jeffrey. McKay says, SCOTUS is deliberating in canceling the whole ACA. We may have no choice but to go for Medicare for all. That would certainly strengthen the national case for Medicare for all, wouldn't it? Overnight, Steve Gonzo says the NFL will stop assuming racial differences when assessing brain industries via NPR. Jeffrey Denton says base benefits on the ACA. It's been more than a decade since the Affordable Care Act and medical bills are still the leading cause of bankruptcy in the United States, while close to 80% of Americans who were forced to file for bankruptcy due to excessive medical bills actually had health insurance at the time. Yes, the ACA is nothing but a gigantic public option giveaway to the insurance industry. Absolutely, Jeff. Steve Wolfbrand says, our government murdered JFK, RFK, Malcolm X, but Martin, but Fred Hampton. This country is one murderous piece of shit. Wake the fuck up. Okay, Steve. So what do you want us to do? All we can do, okay, is our best to change the country, to change the nature of the country. If you got a better idea of how we can do that, and then tell us. Kay says PDA is fighting for Medicare for all. Jeffrey Denton says it's been more than a decade since the affordable was implemented. I think that's a repeat of his earlier comment. And Steve Wolfbrand says, yup. And Jeffrey Denton says, 8 years ago, legal cannabis started in Washington State and Colorado, and now there are only 4 states left that don't have some sort of legal cannabis laws. And Kay says ACA was based on a Romney bill, and he was from Massachusetts. People there hated it too. By the way, that was based on a plan outlined by the Heritage Foundation, a conservative think tank that at one point in its history was funded by the Koch brothers. Maybe they still are. Steve says, I keep a little weed around, but I really don't enjoy it much anymore. Kay says, Scott and I used to grow our own. He got the buds and I got the leaves that I saved from pruning the plant. He called mine Pot Light and laugh out loud. Thea says, hi, Lana, having major Wi-Fi issues tonight, so excuse me, please, if I can't get right back to you. I've had to hold in and out 4 times already. Thea says, go in and out. Correction, Jeffrey says. Back to states, yes, the female cannabis plant gives you a slight sense of euphoria for a couple of hours, but both the male plant known as hemp and the female plant known as marijuana have the same properties besides the amount of THC, which is 3% or less in hemp. The human endocannabinoid system keeps our immune systems in homeostasis, which is balance and harmony. The human body produces cannabinoids that attach to neuroreceptors and achieve this homeostasis. The endocannabinoid system even Steve, and then he ends it. And Steve Gonzo says, I could open a dispensary. Kay says, I don't like to be too stoned, so pot light worked for me, laugh out loud. But Lana says, not a problem. I'm working and cannot type constantly either. Steve Gonzo says, 4 days sober, though NBC, not by choice. Kay says, it just needs to fed, but legalize so we can grow our own if we want to. Kay says, Biden won't be doing that, though, laugh out loud. Steve Wolfman said, I kind of grew out of it besides smoking that shit as a bitch, cough, cough. Would prefer psychedelics if I could get some. Little magic mushroom, right? Steve says, K. Clark Ryan, but I'm sure cannabis is good for health. Kay says, Pot Light didn't give me coughing problems either. The stuff you buy today is way stronger. But Demand Better said, this is one of the first live streams I've caught of Joe's. Well, thank you for being here, Demand Better. And Jeff Benton says, cannabis was demonized and criminalized because of hemp, not because it gave marijuana. It makes fuel oil that burns 90% cleaner than gasoline. You can produce time-released biodegradable plastics with hemp fiber initiative would be part of it. You can grow a new crop of hemp every 90 to 120 days to make paper, or 50,000 other products instead of killing trees. Yes, okay, you can Okay, and also, okay, I understand that growing a new crop of hemp every 90 to 20 days keeps the carbon in the soil, keeps it in the soil. That is very, very important. Steve says there's not much cannabis hemp isn't good for. Steve says exactly. Jeff Denton says since the human endocannabinoid system is literally part of the human immune system, it's all related to healthcare. Steve says hemp is a miracle. Plastics are making our dicks shrink and lowering sperm count. CJRE. Jeffrey Denton says livestock used to eat hemp before it was criminalized, so there was plenty of CBD introduced into the human immune system. Prior to 1937, when the government made a movie called The Reefer Madness and purposely confused hemp and Mary Jane or marijuana, marijuana or grass. Kay says plastics cause kidney stones too. They played us Reefer Madness in junior high school. We all laughed. It was already comedy. I can't remember whether they played it in my high school or not, my junior high school. Jeffrey Denton says, yes, but marijuana makes you rape people and jump out of windows. Kay says, yes, it was stupid. I smoked pot before I smoked cigs. Steve Wolfbrand said, I remember in Reefer Madness, some guy bites the glass off a beer bottle and chewed up the glass. Of course, the girls all got raped. Kay says, yes, it was all BS propaganda. They try to tell us acid will make you jump out the window, laugh out loud. Probably the best thing you could ever do for yourself. Jumping out the window or using acid, Steve. And Jeff Denton said healthcare prices started skyrocketing just after the 1973 HMO Act that neither party will breathe a word about and was supposed to be temporary. Kay says, I honestly never did any drugs except pot. I am a lightweight. Laugh out loud. Evelina says, didn't even know they did. How'd that hope and change work out for you? F that guy. Yeah, we don't go for that hope and change. Kay says, oh, bummer, it was a waste of time. Exactly. The whole Washington Health Trust calls for a 2% payroll deduction and matching funds from the government. I don't know whether that comes from the Affordable Care Act or from the hundreds of millions of people who pay into Medicare every Friday, while politicians keep asking how you're going to pay for it. Of course, under Roe's bill, the what people pay for Medicare every Friday, hundreds of millions of people, would be cycled back to the states. Steve Gunza says some pain will force you to try anything. Steve Wolfbrand said, I've spent months in Cuba. Their doctors don't drive Porsches. I noticed that too. People my age paid in double to Medicare so our parents could get it. Yes, we did. People my age too. But Ro Khanna, it's from the same exact Justice Democrats class as Pramila, okay, and Kamala Harris. I don't think Kamala Harris was a Justice Democrat, was she? Kay says, take me and you to Cuba, Steve Wolfbrand. Steve Gonzo says, let's go. Kay says, I'm more than ready, Steve Gonzo. Steve Wolfbrand said, I studied advanced Spanish at the University of Havana and smuggled thousands of dollars worth of medicines into Cuba. Evelina said, Indians, how about Native Americans? The point being that here in the United States, our legislation is all couched in terms of the older language, okay, of Indians, as opposed to Native Americans. We even have a bureau, okay, of Indian Affairs still, okay, in the federal government. So Roe was just trying to be consistent with the terminology used in federal law. Steve says, I actually got caught once. Enlightened, but Border Patrol turned a blind eye. I still wish them well. They're not all bad people. Steve Gunzo says, I took 2 years Spanish in HS. Laugh out loud. It did help me communicate. Un poco on Puerto Rico. Evelina says, Steve Wolfbrand, and really, Steve? Good for you. Right now, they're sending syringes to Cuba to vaccinate the population. They have the vaccines, but not enough syringes. I understand Cuba has its own vaccines right now. Kay says, never took Spanish in any school, so you guys will have to help me. Evelyn says, I know Cubana Aviacion just took back, don't know how many tons of them that Argentina sent. How many tons of vaccines, or how many tons of syringes? Evelina says, the Cubans, sounds right. They have their own vaccines, but not supplies. Cuban doctors went all over the EU to try to help them with the virus. Kay says, Cuban doctors, the Cubans developed the lung cancer vaccine. And of course, we can't get it. Kay says, yes, I've heard that. Kay says, Sick Care makes tons of money from cancer here. Evelina Pont says, Steve, I never lie, Evelina, at my age. Who gives a shit? Laugh out loud. Steve Wolfbrand, how old are you? I will be 68 next week. Steve Gonzo says, as a presidential candidate in the 2000s, he was ridiculed for backing tuition-free college, single-payer health care, ending the Iraq War, withdrawal from NAFTA, okay, the WTO, same-sex marriage, legalized weed, slashed defense budgets, and a long list of other policies later deemed uncontroversial. And a link to Matt Taibbi, just how rigged is the rigged game? Steve Wolfbrand says, we don't even have a parliament, right, but we got a parliamentarian. Kay says, loved him, the boy mayor who cleaned up Cleveland years ago. Somebody made, you mean the guy called Dennis Kucinich, who ran for president. Dia says, Joe, you already know Biden is going to take the parliamentarians' advice, so he'll have a reason not to pass Medicare for all. He welcomes the excuses. I think Biden may be getting a little fed up with excuses. I may be wrong about that, but he must know that if he doesn't pass anything, except for the American Rescue Plan, that Dems are done in 2022, and he is done in 2024. And I don't think he wants that. I don't think he wants his legacy to be that he was another failed president. And he may be the failed president that ushered in the absolute end of democracy in the United States. Steve Wolfbrand said, same in August. Evelyn said, speaking of Kamala, the VP's niece, Mina Harris, called her out on her wishy-washy position on Palestine. Was that her niece? Interesting. Kay says, no wonder we have so much in common. Steve says, we do. Steve Wolfbrand, Leo, Evelina Pont. She has never impressed me at all. Steve Wolfbrand, We come from a different world than most people. Are you a Leo, Kay? Yes, we do. I'm an old hippie. Kay says, no, Evelina, I'm a Gemini. Dia says, I'm starting to despise McDonough as much as Mansion and Cinema. Yep, the witch, the lion, and the wardrobe, Evelina Pond. Kay says, June 9th is my birthday. Steve Wolprin said, I don't really care if anyone likes me or not anymore. Kay says, yes, I'm kind of there too at this point. I would love to have a real friend, though. None out here in Ohio that I have seen. Dia Swift said, how can we get Biden and the Democrats to stop dragging their feet? I've been calling and get Biden already considering keeping the good tax cuts to appease them. And Kay says, thank you, Joe, very good. And Amber says, thank you, Dr. Joe. Your voice of reason and wisdom is so important. Jeffrey says, thank you so much, Joe. I'm going to send you some information on the financials of how we pay for the whole Washington Health Trust. Thank you, Jeffrey. I'd be very interested in seeing that. And I downloaded Jerry Friedman's paper, and I will make the time to read it. And Dia says, is considering correction. Steve Wolfbrand says, I really think smuggling medicines into Cuba was the best thing I did in my life. I think I saved at least 100 lives. A female doctor in southern Cuba seemed to think so. It's so beautiful there. Steve Gonzo says, oh, snap, crackle, pot. I just found a seed, in the lemon. OG. Haven't seen one for 20 years. Hashtag. And so it begins, Dia Swift said. It's always the ones that say ignorant stuff on here that kill the flow of the stream. Like the FB comment by SW just now, shake my head. How can you not know the difference between Medicare for All, and SS Medicare by now? Steve says there was some really weird drugs on the Cuban doctor's list of what she needed desperately. I would buy the shit in Mexico, smuggle it over to Cuba at great risk. I'd probably still be in prison if not for good people in Border Patrol. Amber says, please follow Ryan Skolnick for the California push for Medicare for All. He is super knowledgeable. Thank you, Amber. And Steve says, they gave me a wink and a nog. Still love those fuckers. Steve says, I want a red beret. Steve, you can certainly get a red beret from Laura Fielding. Steve Wolfbrand said, the thread got a little off course. Sorry, Joe. That's okay, Steve. But we can take a little time off. Sorry. KRTD Media said, hi, Joe. Hello, Shane. And Dia says, how does this important Medicare for All discussion get convoluted with weed and psychedelics glorification so the simpletons have something to add? Frustrating. Dia, you got to be a little easier on people in order to carry on, the discussion. Sometimes, people do get a little off. I mean, that's all right. It isn't really a problem for us. All we got to do is read through it and get to the next point. Kay says, yes, keeps the carbon in the soil. That is true. Evelina Pont says, weird. Amber says, I love you, Bonnie.
That's nice.
And Bonnie says, that was nice. I think Bonnie's a little under the weather this evening. We were lucky this week in that we got some soft-shell crabs as a gift from a friend. I cooked them yesterday for the first time. And, I mean, they were great yesterday, but we had 2 left over for today, and we ate them for dinner as part of a larger dish. Okay, and, they gave, so Barney started to break out some, and she took a couple, allergy pills as a result.
Yeah.
And that's what got you so sleepy, wasn't it?
Yeah.
That you took 2 of the allergy pills.
Yeah.
Yeah, this time. So she has been sort of listening to this with one or both eyes closed because the allergy pills hit her pretty hard. And Dia says, no wonder there isn't a better following. Okay, I'm out of here. Oh, God, Dia, I'm sorry. Yes, stuff she desperately needed. Antifungal shit. I can't even pronounce them. And Dia says, and here comes the wacky lady with her usual nonsense. Stupid, 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 not you, Joe. Ah, Dia, I'm sorry. You feel that way. Carmen says, the regular background now. Cool beans. Kay says, I don't remember if Spanish was an option at the redneck school I went to. Evelina says, Steve Wolfbrand makes sense. Tropical climate. Steve Wolfbrand says, well, in LA, we all speak Spanglish. Or is it Spanglish? Kay says, black people weren't even allowed inside the village limits back in the 1960s. I'm sorry, which village limits are we talking about, Kay? Carmen Muniz says, trifling hippies. And Evelina says, Steve Wolfbrand, but laugh out loud, Kay. And Steve Gonzo says, lost the thread a bit. In PR, I mentioned El Caban, and I thought I said Cabrion. Steve Wolfbrand said, Joe is a voice in the wilderness. Steve Gonzo says, Caban, laugh out loud. Carmen Muniz says, hey, CIA, are you listening? Evelina says, shake my head. Someone was struggling drugs into from Cuba. Kay says, actually, weed is very good for you. So I've heard, Kay. And Carmen says, drugs, typo. Steve says, hashtag Medicare for all. And equals hashtag weed the people, Steve Wolfbrand said. I wish you love and happiness, Joe and Bonnie, first family of the USA. Thank you, Steve.
Nice.
Okay, I wish you love and happiness too. Kay says, my school, East Canton. That's awful, Kay. That's just awful. That was in Ohio in the 1960s. My God. Okay, guys. And Carmen says, bye, Joe. Yeah, good night, Carmen. Yeah, I'm sorry the reception wasn't as good as all that today. Had nothing to do with me. I think it must be weather in various parts of the country. Anyway, have a very good day tomorrow. I will not be going live tomorrow. I will be going live on Saturday. I'll have a number of different things to say on Saturday. If I get some more information or feedback on the state level effort, for Medicare for all, I will cover that at least partly. But right now, what I am planning to do on Saturday is, let me see if I can find it. What I am planning to do on Saturday is to continue, because things are not being done to meet or contain this crisis. We all know it. 1 million dead, okay, from COVID. We have again, okay, the decision of the parliamentarian that we just discussed, threatening to derail the infrastructure plans, okay, of the president. We have corruption spreading within the private sector. We have the fact that the Republicans have a plan to end America, but the Democrats don't have a plan to stop them. We have the idea that a civil war will be bad for business. And we have radically changing coronavirus results. Things are improving in some countries, evidently due to the foothold being gained in those countries by ivermectin treatment. And I will talk about that success in some of the countries. Okay. So we'll be covering a number of different topics. Okay. On Saturday, we may cover more about state-based Medicare for all. But at least that gives you something of a preview. And I'll see you then. And I hope to see you for a really live discussion back then. Kay says, thank you for a great discussion. I love you all. And we love you too, Kay. Steve Wolfbrand said, I didn't smuggle drugs. I smuggled medicines. Steve said, we love Kay, a beautiful person. And Lana says, good night. And good night, Lana. Evelina says, Steve Wolfbrand, yep. Kay says, thank you so much, Steve Wolfbrand. And Kay says, I love you back. I think she meant to say, I love you back. Steve Wolfbrand said, well, I guess medicines are drugs, but not recreational. Okay. I'm not sure that they're drugs when they're artificially created pharmaceuticals. I'm not sure. I'm sure those are drugs. But when they're basically natural substances that have been used for hundreds of years, I don't know whether they're properly described, okay, as drugs. Even when it says new vaccines being developed, we'll be fine. Night, Evelina, says Kay. And Evelina says night, love. And that's it, folks. Good night. I'll see you again on Saturday.